Medicare supplement, Medigap, plans can be a game changer for healthcare costs. One often overlooked benefit is the household discount offered by many insurers. If you've never explored this option, you might miss significant savings. Even more exciting, some plans don't require you to be married to qualify. Here's everything you need to know about how these discounts work, who's eligible, and how to ensure you're getting the best deal for your household. What are Medicare supplement household discounts? Household discounts are incentives offered by Medigap insurers as a way to lower your premium. Insurers recognize that households with multiple Medigap subscribers are often more stable and less costly. To attract these low-risk customers, providers frequently offer discounts, usually between 5% and 14% on premiums for eligible individuals. The good news? You don't always have to be married to qualify. Many insurers allow other household arrangements to meet eligibility criteria. How do household discounts work? The mechanics of household discounts vary by insurer. While the specific rules will depend on the provider, here are the most common scenarios that could make you eligible for a discount. Living with a spouse. Most often, spouses living together can qualify for a household discount if both are enrolled in Medicare supplement plans with the same insurer. This is the most common and straightforward eligibility pathway. Living with another adult. Certain insurers take a more inclusive approach. For example, you may qualify if you live with a sibling, relative, or even an unrelated roommate with a Medigap plan under the same insurance company. This option widens the pool of people who could save money by sharing the same household. Being the only subscriber in the household. Here's a surprising twist. Some insurers offer household discounts even if only one person is enrolled in a Medigap plan, but lives with another adult aged 60 or older, regardless of whether the other person has a Medigap plan. How much can you save? The potential for significant savings from household discounts is substantial. For instance, if your monthly premium is $150 and you receive a 10% discount, that's $15 per month in savings, or $180 per year. Over the life of your Medigap policy, these savings could add up to thousands of dollars, making healthcare costs in retirement much more manageable. Key tips to maximize household discounts. Shop around. Not all Medigap insurers offer household discounts, and the terms vary widely. When you compare plans, specifically ask insurers about their household discount policies to see if you qualify. Ask about non-traditional eligibility. If you're living in a household arrangement where you're not married, don't automatically assume you won't qualify. Confirm with the insurance provider if your situation meets their criteria. Work with a licensed agent. A Medicare agent or advisor can help identify insurers that offer the most attractive discounts. They'll also compare provider options to ensure you're not overpaying for a plan. Plan ahead. Household discounts don't kick in automatically. Many insurers require you to apply through specific channels or demonstrate eligibility with documents like proof of address. Be proactive and gather any paperwork you might need to qualify. Why it matters. Understanding your eligibility for household discounts doesn't just save you money. It empowers you to make Medicare work better for your unique living situation. Have you checked whether your current Medigap provider offers a household discount or if switching providers could save you money? Could you or someone in your household qualify for a less traditional discount arrangement that you haven't yet explored?